Hello everyone, and welcome to our second webinar on meeting the complex needs of our clients. In this session, we'll look at assisting with activities that do not require equipment. We'll focus on assisting in planning recreation activities, assisting in conducting the recreation activities, and assisting the evaluation of these activities. We're going to begin this session by recapping on the importance of confirming clients' characteristics, abilities and needs as we discussed in webinar 1. When you're assisting in planning a recreational activity for a client, you need to confirm their characteristics, abilities and needs. This may include the needs and interests of the client, the numbers of clients, their age, their previous experience and their special requirements. Your participant group may consist of a selection of different types of members, such as experienced clients, inexperienced clients, adults from a variety of different ages and backgrounds, and children. The group's characteristics, abilities and needs will vary for every group, and you'll need to identify and confirm these prior to planning your activities. In webinar 1, we looked at the legislation that's relevant when planning and carrying out activities for older people. We're now going to talk about the legislation that's relevant when working with children. This legislation is the Working with Children Act 2005 in Victoria. The Act outlines the purpose of the Working with Children check, the definition of child-related works, and the requirements for working with a child. If children attend your event, you need to ensure that staff in charge of the activities and that are taking care of them have carried out a Working with Children check, as this is a requirement by law. Next, you need to confirm that your understanding of the requirements of the activity have been met. The best way to do this is to ask for some clarification. You must consider the following aspects during this clarification process. First of all, whether you've obtained all the information necessary to learn about the process and the requirements of this session, whether all the materials necessary for the session have been purchased and prepared, whether the facilities and refreshments are easily accessible by the staff and also the clients, and whether the clients have any difficulties outside the scope of your plan that may prevent them from participating. The best way to check and confirm this information is to consult directly with your supervisor and follow your organisational policies and procedures. Following your supervisor's direction, you need to complete allocated tasks by following the session plan and your organisation's protocol. It's your responsibility to help the clients with instructions and demonstrations when necessary to help them to participate in the activity safely. You should only help and assist within the area of your duties and expertise. For anything outside of these areas, this should be referred to your supervisor. In any case, you also need to pay attention to your duties and responsibilities for meeting health and safety requirements, as we discussed in webinar 1. If you encounter any issues or problems with the venue, the session's progress, you need to work together with your supervisor and resolve these issues as soon as possible. After you've explained all the details and the whole process of the program, it's likely that your clients will have some questions. Some of these questions may be outside your expertise or belong to a different area in which you're not experienced. When in doubt, you need to refer your clients to your supervisor rather than trying to answer these questions yourself. To check whether you have correctly understood their question, you should ask them questions about their concern or their question. Once the issue has been clarified, you need to record and document these questions. And depending on the degree of urgency, you may want to contact your supervisor straight away to follow up with the client. Have you ever witnessed when a person becomes very competitive during a game and takes the game too seriously? Well, for those of you that are currently working in residential aged care, I'm sure that you will have seen this during your weekly bingo session. Bingo can become highly competitive amongst the residents, especially if there are prizes involved. Therefore, it's important that as leisure and health staff, we monitor these games and use the following techniques. We need to supervise the behaviours and watch the conduct of the clients. We need to interact with the clients by involving ourselves within the game. And we need to support participation and performance through different feedback methods. At all times, you will need to ensure that you're following your organisation's policies and procedures for monitoring game conduct. Throughout the activity, it's important to ensure that appropriate responses are made to problems in participants' behaviour or conduct. These may include things such as a client breaking the rules, becoming aggressive, or not participating. Let's now look at some strategies for managing problems with participation. If a client lacks interest, you may need to change the activity or change where the client is sitting. If a client does not understand how to complete the exercise, they may require a demonstration or an explanation. If a client has health issues, they may require a referral to an allied health professional or modifications to the program. If a client's not meeting their goals or outcomes, there may need to be changes in the intensity and a referral may need to be made. If a client is losing motivation, they may need to be supported to engage again in the activity. Their goals may need to be matched with outcomes, or smaller goals may need to be set. When a client is struggling with their coordination, the exercise may need to be broken into smaller portions. They may need to build on other skills first of all, and they may need to practice the session and drills outside of the activity. Finally, if the client lacks interest, you may need to change up the activity or change the client's position. In all cases of problems with participants' behaviour or conduct, it's your responsibility to follow the reporting and communication protocols of your organisation. Then if you can't handle the problems yourself, report this on to your supervisor. When assisting in the conduction of recreational activities, it's essential that you encourage your clients to seek feedback on their progress, their technique and their performance. This feedback process will assist you to identify any further needs of the clients. Feedback is essential for a series of different reasons. Feedback can be sought in a variety of different ways. For example, meetings, forums and focus groups. Direct contact, you can either talk to the client directly one-on-one or within a group, or they could participate in a survey. Once this feedback is received, it's important that the receiver responds to this. This involves incorporating the feedback sought into the current or future actions of the program. To determine whether it's appropriate to use the feedback received, it's important to consider if it is received objectively. This means the receiver should look at the feedback as an impartial, detached, and in an unemotional way. They shouldn't take the feedback personally or become upset if they receive any negative feedback. Although all feedback has particular critical features, or may have particular critical features, it can be valuable, and it's important to remember that in most cases, feedback is just someone's subjective opinion. So rather than simply accepting all the feedback as a reflection of the truth or the reality, you need to think about it critically. This will help you to decide which piece of feedback you need to act quickly upon and which piece of feedback may be inaccurate or unhelpful in your evaluation. It's important that you evaluate each component of your program. Essentially, you're evaluating your program to determine that it's meeting your clients' needs and therefore assisting them to achieve their goals. You can use this information to improve the design and the implementation of your program. There are two primary approaches to collecting data that will enable you to monitor and evaluate your program. This is both qualitative and quantitative data. Both of these methods have a similar aim to deliver an answer to a question. However, both go in different ways to achieve this. Essentially, quantitative measures involve numerical data and are used when something needs to be measured, whereas qualitative data involves and uses data and words so that things can be investigated further. By combining quantitative and qualitative approaches, it's referred to as a mixed method approach. Often in evaluating a community program, such as an exercise program, a mixed method approach will be used. This is useful because it can give you a more thorough understanding of the impact of the activity that you've implemented. Let's have a look at the following example that includes a program evaluation survey that will be distributed to clients and which combines quantitative and qualitative measures. So the quantitative part of the evaluation asks, please tell us how satisfied you are with the aqua aerobics program. It then asks the client to rate it on a scale of 1 to 5, 1 being very dissatisfied and 5 being very satisfied. Then the qualitative evaluation asks, please provide more information about why you rated the aqua aerobics program in this way. So once we've received the numerical figure, we then get the client to write in words the reasons why they were very satisfied or dissatisfied or neutral with the program. Remember, combining quantitative and qualitative evaluations can provide you with a more thorough understanding of the program you've implemented and if it's meeting the client's needs. During the session evaluation, you will need to provide your personal feedback on the session outcomes to the people you're working with. This may include your supervisor. When giving feedback to others, you should consider the following information. You should try to make it positive. Before giving feedback, make sure you remind yourself of why you're doing it. Be timely. So talk about the issue that is current and what's currently occurring within the program. Make it regular. So if you want to provide feedback to your supervisor or another staff member, say it regularly. Prepare your comments. So you don't want to read a script, but you need to be clear about what you're going to say, as this will help you to stick to the issues and cover the points that you need to address. Be specific. So tell the person exactly what they need to improve on. Establish a safe place to talk so you won't be interrupted or overheard. So it wouldn't be appropriate to provide feedback about the program or a staff member in the corridor. Use I statements. So give the feedback from your perspective. This avoids labelling the person. Limit your focus. A feedback session should discuss no more than 2 issues. Otherwise, the person you're providing feedback to may feel attacked. Talk about a couple of positives too. A golden rule is to start off with something positive. This helps the person ease into the feedback session. Provide specific suggestions. So make sure that you both know what needs to be done to improve on the situation, and follow up. The whole purpose of feedback is to improve performance. So you need to measure whether it's improving or not and make adjustments as you go. Once you've received feedback from participants, it's important that you communicate that feedback to other members of staff, and this could be done, as we just discussed, verbally, or it can be done through documentation. If you do it through documentation, you have a record to refer to in the future. Make sure when completing documentation that you record the facts, that it's written as soon as possible, that it's accurate, legible, unaltered and objective, and it includes the printed name and signature of the person, for example, yourself, who created it. When communicating and documenting feedback, you need to focus on the following areas. First of all, you need to focus on sustainability and the safety of the facilities. So you need to know whether the session met all the health and safety requirements. The activity covers all aspects of sustainability, for example, waste management, and the participant feels safe and secure throughout the activity. When it comes to the content of the session, you need to know whether the participants were satisfied in the content of the activity or event, the aims of the session were achieved, that all areas of entertainment, socialisation and general life improvement were covered, and whether the selection of activities for the session was appropriate and met the expectations of the client. When it comes to the structure of the session, you need to know and look at, were there any problems with the timing or scheduling or the location of the session? The activity arrangements, were they appropriate and did they meet the expectations of the client? And did the participants or clients have any particular problems with the program? Finally, when it comes to participant progress, you need to know whether the participants have achieved what they expected to within the program and have they made any progress with their goals. These elements are very important to evaluate when you're evaluating your program and session before you make any changes, and then your changes can be implemented. I'd like to thank you for your participation in this webinar. Continue now by watching this video on Snoozelen therapy, or also known as sensory rooms, that are useful for clients with dementia. Some of you may have a sensory room or something similar set up in your current workplace, but for others this will be your first introduction to the benefits of Snoozelen therapy. Thank you for your time.